Alright, greetings to everyone, and you're all welcome to our day's discussion in medicine with me, Sandes Ngalamba. Yes, so today we're going through hypertension. The stem of the question reads, Mrs. Muloz Kalialia, 44 years old, married with 6 children, is admitted to a medical ward with a provisional diagnosis of secondary hypertension. Yes, then question A1, it is saying define hypertension. So how do we define this condition? The marks are located 5%. Okay, so in my definition, I'm saying hypertension, basically this is just a condition in which there is a sustained elevation of arterial blood pressure with a systolic of over 140 and the diastolic of over 90 millimeters of mercury. And it is mainly characterized by headache. Yes, that is the definition of hypertension. So when we're defining this condition, it is very important, it is very vital that we mention to say in hypertension there is what? Sustained elevation of arterial blood pressure. That is the main important thing that you have to mention in your definition. Yes. Then question A2, it was saying list 5 signs and symptoms of hypertension. Yes, list 5 signs and symptoms of hypertension. So what are the clinical features? The first one is what? Headache. So basically headache, it occurs as a result of what? Cerebral hypoxia. Yes. The second one, it is what? Dizziness. So dizziness, it also occurs as a result of what? Cerebral hypoxia. Yes. The third one, difficulties in breathing. Yes, we all know to say in hypertension there is what? Impaired gaseous exchange, which in turn bring about what? Difficulties in breathing. Yes. The fourth one, it is what? Confusion. So confusion, it occurs as a result of what? Damage to the brain. Yes. The last one that I would mention, it is what? Chest pain. Yes, so chest pain, it occurs as a result of what? Myocardial ischemia. Yes. In addition to those, I could also talk about what? Tiredness. I could talk about heart palpitations plus many more clinical features. Yes. Then question B. Question B, it was saying explain 2 classifications of hypertension. Explain 2 classifications of hypertension. So what are the classifications? Hypertension is classified in 2. We have primary hypertension and we also have secondary hypertension. Yes. So for primary hypertension, this one it is at times known as what? Essential hypertension. Yes. Primary hypertension, it is at times known as essential hypertension. It is the commonest form of what? Hypertension, because this one it contributes about 90% of all cases of what? Hypertension. Yes. So the cause of primary hypertension is what? Idiopathic, meaning it is unknown. But it is believed that it has a tendency to run in what? In families. Yes. So meaning that primary hypertension, it is what? Inherited. Yes. Then the other type of hypertension, the other classification, it is what? Secondary hypertension. So this one, it basically accounts to about 5% of people with what? Hypertension. Yes. Secondary hypertension, it has a known cause. Yes. The cause of secondary hypertension, it is what? It is known. That could be some disorders such as heart failure, disorders such as kidney failure, plus many other medical conditions. Yes, the cause of secondary hypertension, it is known. Yes. So before I go to question C, it is very important that we also know the predisposing factors of hypertension. Yes, we may be asked about the predisposing factors. As such, it is very important, very vital that we know them. Yes. So the first predisposing factor, it is what? It is excessive intake of salt. Yes. Excessive intake of salt may bring about what? Hypertension. The second predisposing factor, it is what? Age. Hypertension, it is very common in individuals that are over the age of what? 60 years. Yes. The third predisposing factor, genetic. It has the tendency of what? Running in families. Yes. The fourth one, lifestyle. The last one that I could mention, it is what? Obesity. In addition to those five, I could also talk about what? Renal failure, diabetes mellitus, plus many other medical conditions. Yes. Okay. So getting back to question C. Question C, it is saying describe the management of Mrs. Kalialia from admission till discharge. Yes, that was the question. So this management, it requires us to talk about the medical management and also the nursing management. Yes, so on the medical management, it has two components. We talk about the investigations or the diagnosis, and we also talk about what? The treatment. Yes, so on the investigations, what investigations can we carry out on this patient? The first one is what? History taking, which will review the predisposing factors that we've just what? Mentioned. Physical examination, it will show us the what? The clinical features, the ones that we've just what? Mentioned. Yes. We could also check for the blood pressure, which will show, or which will review an elevation in what? In arterial blood pressure. We can also do renal function test. Yes. So renal function test, it is done to rule out renal conditions such as renal failure. Autography can also be done to rule out coarctation of the aorta. Yes. Urinalysis can also be performed to rule out what? Renal disorders. Yes. So those are some of the investigations that can be done in a patient with hypertension. Going to treatment. Hypertension, it is treated by giving antihypertensive drugs, of which antihypertensive drugs are classified in so many ways. We have beta blockers. We have we have angiotensin converting enzyme inhibitors. We also have diuretics. In addition to that, we also have vasodilators plus many other antihypertensive drugs. In some questions, you may be asked to talk about these classifications, mentioning the mechanism of action, mentioning examples of drugs that are found in those classifications, and also the doses of what? Those drugs. But this question did not ask us about that. Yes. So in this case, we're going to mention at least 4 drugs from each what? From each class. Yes, 1 from each class. Yes. So under calcium channel blockers, we can talk about what? Nifedipine. Yes. So nifedipine, this one, it is given at a dose of what? 20 milligrams. That is twice daily for a period of 5 days. We can also give diuretics such as what? Lasix, which is given at a dose of 40 milligrams. That is 3 times a day for a period of what? 5 days. We can give vasodilators. An example of that, it is what? Hydralazine, which is given at a dose of 20 milligrams. That is twice daily for a period of what? 3 days. Yes. Then we can also give angiotensin converting enzyme inhibitor such as what? Enalapril. Yes, so these are antihypertensive drugs that we can give in the treatment of hypertension. Yes. Then for the nursing management, we just have to use that general nursing management. This patient has to be what? Has to be resting. So we have to mention that in our management. Under nutrition, it is very important that we restrict salts. Yes, excessive salt intake should be what? Restricted, because excessive intake of salt, it contributes to what? To hypertension. We have to mention all that. Yes, we have to mention that. Then for the complications, which is question D. Question D, it was asking us to explain 5 complications Mrs. Kalialia may develop. The marks allocated were 20%. So what are the complications? We have brain damage. Yes. The blood vessels within the brain may get what? May get ruptured, hence leading to brain damage. Yes. We could also talk about CVA, that is cerebral vascular accident. We know to say hypertension, it is one of the major causes of what? CVA. So it's very important that we mention that. The third complication, it is what? Renal failure. Yes, the kidneys may fail due to increased hypertension. Vision loss. The person may lose his or her vision because of what? Hypertension. Yes. Then the last one that I could mention, it is what? Heart failure. CCF. Yes, the heart may fail. So those are the complications that Mrs. Kalialia may develop. Alright. So thank you very much for your time. Don't forget to share the video.